In a country like Lesotho, people travel for days in search of a COVID-19 vaccine. But at the moment, they are very unlikely to get one. Only 36,000 people here have been vaccinated, including a tiny fraction of those considered most vulnerable to infection. And they live on a continent where just 1.5% have been protected. Yet donations from the world's wealthiest nations are now trickling in. Today, the UK said it would supply 800,000 doses to Kenya as part of a tranche of 9 million jabs.
We won't be safe in the UK until everyone is safe around the world. But it's also in our direct interest in terms of opening up the economy, opening up international travel and making sure we don't see fifth, sixth waves of this virus or its variants.
Moral interest and self-interest at work as Boris Johnson and Kenyan President Uhuru Kenyatta talk trade, investment and vaccines in the garden at Chequers. The Prime Minister promised to send 400,000 jabs this week. But Kenya, like the rest of Africa, needs tens of millions of vaccines. The World Health Organization's COVAX facility ground to a halt last month, leaving officials in an impossible spot. The head of vaccinations in Kenya telling us his program was running on fumes.
As of today, in Kenya, we have received 1.733 million doses of AstraZeneca, and we have actually vaccinated about 1.7 million people. So today, even as the UK was making the announcement, we had less than 30,000 doses, and yet the demand is very, very high.
Well, that is a nerve-wracking way to run a national vaccination campaign.
Yes, it's nerve-wracking. Of course, it's experience, but it's from such circumstances that we learn a lot.
In Africa, they've learnt they have to start making vaccines in Africa. Otherwise, wealthier countries buy up the stock. And here in South Africa, 2 factories will now start to make these vaccines. In fact, one has already started in what's probably the best way to overturn these global inequities.
It's said that you have to have a tragedy first, for things to really happen. But I think, in a nutshell, that's why we need more capacity.
It's a start, but health officials need 1.5 billion doses to inoculate 60% of the African population. A task and a challenge that will take years. John Sparks, Sky News.